eyeball tattooing. Yes, it's really a thing. People are getting their eyeballs tattooed. They're getting colorful eyeballs, they're getting black eyeballs so you look like a doll and people can't see where you're looking. It's definitely something that's on the fringe of body modification, but clearly people are asking for it. So let's talk about what it really is, how you do it, and maybe why you should think twice about doing it. The technical term is scleral tattooing. So tattoo ink is being injected with a needle beneath the outer filmy layer of the eyeball, which is called the conjunctiva. That ink is then sitting in a blob between the conjunctiva and the white of the eye, which is the sclera. The ink then travels around between those two layers and colors the white of your eye or the sclera, whatever color ink you've injected. The result is permanent and you can't reverse it. So what can possibly go wrong with sticking a needle into your eye and tattooing it? Well, the first obvious thing is that needle can go too deep and actually puncture the globe of the eye. This can cause the eyeball to rupture or decompress. That can affect vision. Also, ink can then be injected into the inside of the eyeball. That can cause infection, inflammation. It could also interfere with the cells that are in the eyeball, which is responsible for determining vision, and also can cause separation of your macula, which can then lead to blindness. The other thing that can happen is the ink that's injected could be a little bit lumpy. And even though it may look like you want it to look, that little bit of unevenness between the outer layer of your eyeball and your sclera, the white of your eye, can lead to this sensation of a foreign body. So if you've ever felt like you have a piece of sand in your eye or a hair in your eye, that's the feeling that you can get forever. Obviously, with any procedure, we know that bad things can happen if it's done incorrectly. But even if this is done correctly, bad things can still happen. So yes, you might not get rupture of your eyeball or that foreign body sensation, but you can still have a reaction to the tattoo ink that's in your eye. So you can get an inflammatory response, an autoimmune response that can cause chronic inflammation of your eyeball that can then cause irritation that can lead to long-term vision difficulty. There are certainly people who have had this procedure done successfully and are very happy. There are also people who have had this procedure done and have had major complications, including blindness. So yes, tattooing your eyeball is a thing. People do it. You should be very, 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 very careful if it's something you want to do, and just be aware of all the potential complications, because unlike with some other procedures and other things that are extreme plastic surgery procedures, complications around your eye are often not reversible. And you're talking about potentially losing your vision. So that's a big deal. But everyone has to make their own decisions about what they want to do. And I'm just presenting the facts so you can be educated and decide whether or not this is really something you want to do. If you like this video, make sure to like, comment, and share. And also make sure to check out all the other videos on my YouTube channel. I'm Dr. Matthew Schulman, board certified plastic surgeon, New York City.